Thank you very much, friends, all participants, faculty, brilliant sessions. And really, indeed, it's a great day for us at CAHO. And we really dedicate this series, the CQE series, to all those CSSD professionals who are working tirelessly across the country and who have joined us today in great numbers. And today it's become a global event. Thank you for that. We're going to be spending the next 10 to 15 minutes on something that is very close to our heart. This is going to be a continuous learning exercise for our CSSD professionals. So we all know the pivotal role of the CSSD department and the way they, they enrich the services in a hospital and how they provide items in the hospital which are used to provide best quality care to the patients. The CSSD plays a very crucial role in lowering the infection control rate within the hospital. This brings a very strong need for the CSSD staff members to know how to perform every CSSD task and also to understand why it is being performed. To pursue these objectives, CAHO, in association with 3M India as our technical guidance partner, has planned to launch a year-long program, Project ACE, and that's what we are going to be launching now. So it's a great moment for us, and it's going to be a wonderful initiative that we are going to be involving with the CSSD across the country. So what are the benefits to the healthcare organizations? The primary objective of this ACE program is to facilitate capacity building among CSSD professionals, share best practices, and provide benchmarking while promoting and continuously improving the quality and safety of healthcare services as per the latest standards and guidelines. ACE program is going to help us in knowledge enhancement through basic and advanced courses for the CSSD professionals, guidance and consultation by the experts to the CSSD staff to promote adherence to the standards and guidelines, certification for the CSSD professionals by CAHO after successful completion of the courses, auditing and gap analysis of the CSSD facility. Upon fulfilling 80% compliance, certification from CAHO for the CSSD facility, recognition and awards for the winners at CAHOCon. And how is this program going to be carved out? How are we going to go about? This is going to be the schedule. We will be opening the registration link on the 1st of June 2021. And the CSSD team of the hospitals can undergo the basic and advanced courses, and they'll need to complete the assessment on the virtual 3M Healthcare Academy platform. So we will be linking the CSSD professionals to the 3M Healthcare Academy platform. The CSSD will then perform a self-assessment and submit the report online. They will then be audited virtually and physically by CAHO empaneled auditors. Participants who have scored 80% and above would receive the ACE certification, and the finalists would be invited to CAHOCon, and the winners would be announced during CAHOCon. The awards we plan to promote in 4 categories: small healthcare organizations up to 100 beds, medium healthcare organizations 100 to 300 beds, large healthcare organizations above 300 beds, and government and public healthcare organizations is another category. So this is a very exciting thing ahead of us in the coming year. And to launch this program, I invite Dr. Vijay Agarwal, President CAHO.
Thank you, Lallu, for the absolutely brilliant introduction to this program, and good evening, everyone. The vision of CAHO is to undertake capacity building initiatives in the area of healthcare quality and safety through education and skill building programs, and to introduce continuous quality improvement and patient safety measures by developing and upgrading appropriate quality measures, especially to improve outcomes. And as you have been listening, disinfection and sterilization and hence CSSD is of huge importance. It gives me immense pleasure to launch the prestigious program ACE, which is well-designed and curated model for CSSD facilities of the healthcare organizations to improve competency and compliance, thereby adhering to the standards and guidelines for better patient safety. And as somebody said in the first session, to improve sustainable compliance. At CAHO, we are very happy to be associated with 3M India, who has always been in the forefront to educate, spread awareness, and enhance the capabilities of the healthcare professionals as a knowledge guidance partner for this ACE program. I request hospitals to register and utilize this opportunity to get the CSSD professionals trained and certified, and the CSSD facilities to upgrade their practices under the able guidance of CAHO and 3M team. ACE program is wholesome package for the CSSD professionals and CSSD facilities, which offers training, consultation, auditing, certification, and recognition by CAHO. And so, in the presence of all of you, all the faculty members, and my dear patron members, we launch this program today. Thank you.
Thank you very much, sir. I now request Mr. Rajiv Gupta, Executive Director, Healthcare Business 3M India Limited, to deliver his address. Over to you, Rajiv.
Good evening, Lallu ma'am, and good evening, Dr. Vijay Agarwal, and the whole CAHO team and people on the call. Let me start by expressing my heartfelt gratitude to all of you on the call and outside this call, the healthcare workers, for putting our lives and safety ahead of yours and also your families. I know words can't be enough to thank your efforts. I can only say thank you from bottom of my heart. I would also like to take this opportunity to remember one of our colleagues, Dr. Ravi, who passed away last week due to health complications. He was leading the clinical specialist team for 3M for the CSSD, and he was an integral part of the ACE initiative that we are launching today. During the global outbreak of COVID, 3M has been at the forefront of efforts to keep the frontline healthcare workers and first responders protected. We have supplied critical products like respirators, PPE kits, hand sanitizers, and surgical scrubs to healthcare facilities and healthcare providers. In 2020, we made nearly 2 billion respirators, which means more than about 55 lakh respirators a day. And that we have been supplying to global healthcare facilities, to the workers, including doctors, nurses, and dentists. And it's a matter of pride for us that we gave priority to all the healthcare facilities and workers. Our products were not sold in the pharmacy channel or outside the healthcare facility. So that is a matter of pride. As well as we regulated the prices. So you saw a lot of price gouging happening for respirators when the pandemic was at its peak. We ensured the product, the prices what we were selling pre-COVID was actually lower during the COVID times and made available to the healthcare professionals. As we tried to keep pace with the demand globally, the initiative was not only to provide the respirators, but also educate people on the usage and disposal of those respirators. It's critical that we understand that it's a biomedical waste and you can't just use it and throw it anywhere. Disposal is a critical part of that, and that we have been doing as a part of our infection prevention initiative in the healthcare space. Let me start by giving you a brief background about 3M. 3M started as a mining company about 120 years back. It started at Minnesota, which is in North America, and started as a company named Minnesota Mining and Manufacturing Company, the 3Ms, that's why it's called 3M. It's a global powerhouse now, 60,000 products operating in 70 countries and sales in 200. That is what 3M is today. Our products are used in homes, businesses, schools, hospitals, dental clinics, and a lot of industries. Approximately 33% of our sales come from products invented within the last 5 years, thanks to innovations from thousands of researchers and scientists we employ worldwide. We are committed to creating the technology and product that advance every company, enhance every home, and improve every life. You may not believe it, but you are rarely more than 10 feet away from a 3M technology. And again, it's a matter of pride that we contribute to the human being and humankind in such a big way. We are proud to be global partner for healthcare professionals. With years of painstaking research, we produce top quality, reliable products and solutions that help transform outcomes for patients and ensure better health. Our innovations are driving medical advancements in hospitals, emergency rooms, and CSSDs globally. 3M and CAHO share a common vision of upgrading the healthcare practices in India, as well as upskilling the healthcare workers. We have a commitment to make this vision a reality. I strongly believe that if we must work towards reducing HAIs, which has been discussed in the earlier sessions, it is imperative that CSSD fraternity is well-trained, skilled, and has all the opportunities to advance their knowledge around the latest technology and practices. 3M understands this, and we have been working towards this goal for the last decade. It is no mean feat that so many ex-3Mers are in the panel to talk about CSSD space and involved in spreading the best practices. We have been recognized by the Quality Council of India for this effort. We are knowledge partners with Healthcare Sector Skills Council for the CSSD and working diligently to get CSSD employees recognized as the allied and healthcare professionals. We have worked on defining the roles of CSSD managers, CSSD technicians, and CSSD professionals. We will see our efforts fructifying in the near future. I would request the support of CAHO, HSSC, and all the key healthcare professionals here in the decision-making and influencing roles to drive this through the professional advisory boards, which have been set up for defining the CSSD professionals as allied and healthcare professionals. This brings me to the action today. My belief and that of my team is that learning, education is the best investment we can make on ourselves, and better learning and awareness helps us take better decisions. I'm extremely delighted to be part of the ACE launch program. It is a well-defined quality improvement program and caters to CSSD process improvement along with individual learning requirements. The overall program objective is to make the CSSD team aware of the gaps in the current process and people's knowledge of the process and bridge this gap. Both basic and advanced modules have excellent content, and automation in the ACE program gives the added advantage in terms of keeping track of the progress in the course completions as well as learning for the participants. The timing of this program is also very opportune. Our country is in the midst of the second wave of pandemic, and the entire healthcare industry is highly sensitized. ACE should go a long way in achieving this objective of preventing infections. Pandemic situation which would eventually improve, and when the hospitals start opening up, there'll be a huge number of patients lined up. CSSD department will be stressed to continuously roll out instruments at a faster pace without compromising sterility. And that shall be the moment of truth. It shall not only be your knowledge, but also the expertise and knowledge of your team, entire team, that would help you manage the situation and take right decisions and do what is right. I would strongly urge each one of the participants today to ensure that you take advantage of the ACE initiative. As CSSD leaders, you should take initiative to register your hospitals and encourage your fellow colleagues to participate. I would also like to take this opportunity to congratulate and thank Dr. Vijay Agarwal, Lallu ma'am, and entire CAHO and 3M team who have relentlessly worked on this ACE program and brought it to life today. I would like to re-emphasize that 3M is committed partner in this noble endeavor, and we will continue to give more than 100% to make this program a huge success. I would close my speech by asking each one of you to give a wholehearted support, and happy learning to all of you. Thank you.
Thank you, Rajiv. And CAHO believes in collective synergy, all of us coming together for the betterment of the industry. And I'm sure this program is going to be beneficial to all the CSSDs and also the hospitals and the patients. Thanks for supporting us.